Started.
हाँ सर.
ठीक है. Hello, hi everyone. I am Dr. Akhil Tambi, and I will be discussing the questions that were asked in the FMG July 25 Radiology. Okay, so let's get started now. So the first question was regarding the identification of the tarsal bone. Okay, and the arrow that was marked on was on this bone. Okay, so this one bone which is looking like a boat shaped bone. Okay, so it is a boat shaped bone. So it is what is known as the navicular bone. Okay, so this is the navicular bone. Then we have the medial, middle, and the lateral cuneiform bones here, and then we have the tibia here. Then we have the talus over here, and calcaneum over here. Okay, and this one is the cuboid bone. Right. So this was the question asked most probably, and the answer was navicular to this. Then moving ahead to the next question. So the next question was regarding an IVP image, and two questions were asked regarding IVP image. So one was regarding just the identification of the IVP image. Okay. So in this we can see the PCS of the kidney. In this we can see the PCS of the kidney is there. Okay. So this PCS is completely filled. Then we have the ureter. Okay. Then we have the bladder over here. So if we inject the contrast IV, then entire pelvic LACL system, ureter, and bladder will be filled with the help of the dye. Okay. So if they are filled with the help of the dye, so that means we have given the contrast IV and it will be IVP. In X-ray, nothing of this sort will be given. In retrograde pyelogram, so one is retrograde urethrogram and one is retrograde pyelogram. So in case of retrograde pyelogram, what we can see, in case of retrograde pyelogram, what we will be able to see is we will be able to see a urethroscope that is inserted inside the bladder, and then we are going to fill the dye. Okay, so that is not given here. You can't see anything in the bladder, so that's a wrong option. And in MCU, only bladder and urethra will be visible, and not the ureters and the pelvic LACL system. Okay, so the answer to this question will be IVP. Then the next question, this is a very classical question. Okay, the child presented with central cyanosis and the chest X-ray is revealing the boot-shaped heart, also known as core and sabu. Okay, core and sabu. So boot-shaped heart, core and sabu. This is a very classical question. This is what is seen in the top. Okay. And in ASD, VSD, or AVSD, nothing that sort of boot-shaped heart or anything is given. And in TOF, due to the right ventricular hypertrophy, what happens that the right ventricle hypertrophies from here and it pushes the apex of the heart towards upwards. So that's why a boot shape is formed. Okay. The next question, this is also a very classical question. Okay, so the patient presented with a severe headache to the emergency department and the CT scan was performed, and in the CT scan what you can see, the fluid is filled in the cisterns. In all the cisterns there is fluid, and it is making a classical appearance of a star. Okay, so this is what is also known as star of death appearance. Okay, star of death appearance. The most common cause of the subarachnoid hemorrhage will be trauma only. Okay, so the most common cause will be trauma, and next will be the Berry's aneurysm rupture. So both of these cause subarachnoid hemorrhage. So this star of death appearance classical is what is seen in the SAH. Okay, subarachnoid hemorrhage. Then coming on to the next question. The next question was again regarding identifying the investigation shown in the image. So basically in radiology, you should also know the name of the image. Okay, what all investigations are there and what all they appear, because such simple questions are asked, and if you can't remember them or recall them, then that will be a blunder. So this is also a very very important and very easy question, and the image shows the mammography. Okay, in CT scan, X-ray, MRI, all of us know how they look, so they are not at all like this. So this is what is known as the mammography, and in this we have two views. One is the MLO, mediolateral oblique view, and another one is the CC view. CC view is the craniocaudal view. Okay, so these two views are there with us in the mammography, and this is also a very easy question to be asked. Then next image, again an IVP image was given and they asked what is the diagnosis. Okay, so in this classical IVP image, what we can see is we can see at the terminal end of the ureter. Okay, at both the terminal ends of the ureter, we can see there is a cystic dilatation of the ureter, right? So there is cystic dilatation at the terminal end of the ureter. That means that we have an we have a terminal end like this. So this is what is known as the adder head appearance. Okay, this is what is known as the adder head appearance. So adder head appearance is very, very classical, and in this image, since it is on both sides, so it will be a bilateral ureterocele. Okay, it will be a bilateral ureterocele. That means ureter is dilated from the terminal end. Okay, so this is also a very, very simple question based on IVP findings. Okay, next question. Next question was regarding, I don't know whether image was given or not, but it was regarding the LINAC mechanism of action. So mechanism of action. So LINAC is what is linear accelerator, right? So in linear accelerator, what we do, we give teletherapy. Okay, we give teletherapy, radiotherapy in the form of teletherapy. That means from a distance, we do what we electrons, we fire electrons, okay, or x-rays you can say. So electrons or x-rays, these are of high energy. Okay, high energy electrons and the x-rays are delivered from this LINAC, and they target the particular cancer cells that are located inside our body. Okay, so this is a form of teletherapy. So this was the question asked in the FMG. Then the next question, this question was just regarding the 11th class physics, and it was regarding electron volt definition. So very, very simple. Electron means a single electron, and volt means voltage. Voltage is what? Voltage is potential difference, right? So potential difference of 1 volt. So suppose if we have two electrodes, okay, and this is suppose of 0 electron volt, and this is of 1 electron volt. So there will be a potential difference of 1 electron volt. And if we have an electron over here, so what will happen? The electron will move from an area of low potential towards the high potential. Okay. And in this duration, it will gain some kinetic energy. Okay. It will gain some kinetic energy. So that kinetic energy that will be gained by the electron from 0 volt to 1 volt, 1 volt potential difference, that will be called as the electron volt. Okay. So this is also a very easy question. Just based on common sense, you can answer these kind of questions, and you don't have to think that, oh, we have not studied this, or it was not in our course. There is nothing like that. You just have to apply your common sense and your presence of mind while solving the questions, and you will be easily able to solve these kind of questions. Okay, now next question was regarding eggshell calcification. So eggshell calcification is seen in 2 3 conditions that you must remember. One is silicosis. Okay, one is silicosis. One is sarcoidosis. One is sarcoidosis. Okay, one is sarcoidosis, or you can say one is coal workers pneumoconiosis. In that also eggshell calcification can be seen. So based on the history of the patient and some other findings, you have to deduce what can be the answer to this question. Okay, but I think the most commonly it is seen in silicosis, and I don't know what the other options were. So in this question, if silicosis was there in the option, then that must be an answer to this question. And we will see a sand blasting. Okay, a person from a sand blasting or sand stone cutting industry. Okay, stone cutting industry, and that will replicate as eggshell calcification on the chest x-ray. Okay, so it will be seen on the chest x-ray image. Okay, so that is the thing. You will, on the hilum part, you will see these kind of or radio opaque densities onto the chest x-ray. So that will be the eggshell calcification. Then coming on to the next question. In this, a 2 week child was given, and the parents will come that the child has fallen, or the child was hit by someone else, or that kind of thing there will be there. And there will be multiple x-rays shown to you. Okay, so in the multiple x-rays, you will see the fractures that are there. Okay, so this is a metaphyseal fracture, and that is what is classical in case of battered baby syndrome. Okay, so battered baby syndrome, it is also known as non-accidental injury. Okay, so in this, it is not accidental, it is non-accidental injury. So parents are giving history of falls. That is a false history. Okay, parents will give a false history. They will give a false history, and they are beating the child, and that's why when they shaken baby syndrome, it is also known as the battered baby syndrome. So when they hold the child and shake the child, then what will happen is the rib fractures. Okay, so you can see multiple rib fractures in this. Posterior rib fractures will be very, very prominent in this condition. Okay, so this is battered baby syndrome, or you can call it shaken baby syndrome. Okay, shaken baby syndrome. So all these are synonymous only, non-accidental injury. Okay. And there can be humerus fracture, there can be femur fracture, there can be multiple fractures. So this kind of question was given, and this is not at all fall from height or birth trauma or injury due to blunt object. The parents will classical give you a false history and multiple x-rays shows fracture. That means it is a battered baby syndrome without any doubt. Okay. Now, moving ahead to the next question, the patient presented with a knee lesion. Okay, so not knee lesion. Basically, he had painless lesion. Okay, in the knee, and when we did the X-ray, we could see this kind of lesion in the metaphysis. Okay, so this is located in the metaphysis. So this kind of lesion in the metaphysis, and what we can see in this question is that there are irregular. Okay, there are irregular margins. So irregular margins are there on this chest X-ray. Okay, if you can trace this, this is a bit of irregular margin. So irregular margin, and there is a lytic lesion. Okay, it is a lytic lesion, lytic irregular margin lesion is there on the tibia. Mostly on the tibia, it will be seen, hai na? And it is what is known as the Brody's abscess. Okay, it is what is known as the Brody's abscess, which is what is a result of subacute osteomyelitis. Okay, subacute osteomyelitis, right? So this is also a very important question, and directly a spotter what is asked at multiple in multiple exams. It has been previously also asked, so this is also a repeat kind of question only. Okay, now coming on to the next question. So the next question, okay, so this much only. So thank you everyone for joining the session, and I hope if any other question has been asked, then please do mention in the comments or DM me if any other question was asked. So these were the questions from radiology, and please consider radiology. Just see all the images that are coming with every disease, any radiological images there, because that will help you remember the disease, the diagnosis, and that will easily, you can just see, it will be a spotter kind of question for you. If you know the radiological image, then you can answer the question within less than 30 seconds, and that will save your time, and that will boost your score as well. So thank you everyone for joining. Thank you.